Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Sitting in for Pinky Webb, I'm Menchu Macapagal. Today on the program, a House committee approves a bill postponing the barangay and SK polls, but preparations continue pending an actual law. Calls to ditch the old vote counting machines escalate. COMELEC Chairman George Garcia joins us live. And later, the Interior Department wants to pilot test the optional face mask policy in Cebu City. Health reform advocate Dr. Tony Leachon also joins us later in the program. Let's begin with the Interior and Local Government Department wanting to pilot test the relaxed face mask rule in Cebu City. But Mayor Mike Rama says he will push through with his executive order that no longer requires the wearing of face masks outdoors. Interior Secretary Benhur Abalos says he will discuss the matter first with the Interagency Task Force on COVID-19. He adds local government units cannot have conflicting policies on pandemic response.
I know he has good intentions, very good intentions at that. Pero I'm sure kung ipipresent ko naman sa IATF ito, baka payagan naman ipilot ang Cebu. Let's say magpilot ka ng ilang linggo at dito maas, yun na yun. It's a good template for everyone. Lahat makikinabang dito. But what is important right now ay sundin natin itong tamang proseso.
Following Cebu City's executive order, neighboring Mandaue City also plans to ease the face mask mandate, especially in open spaces. Let's go straight to the source of the story. Our source today, health reform advocate Dr. Tony Leachon. Good morning, Doc, and welcome to the program.
Good morning, Menchu, and good morning to all televiewers.
Doc, so as you heard, Cebu City nga has temporarily suspended its executive order easing face mask rules. Do you think it's about time to allow for the optional use of face masks in open spaces?
Well, with due respect to the Cebu City LGU, because I know there's a local government code invoking their autonomy, I think as a national policy and based on the Department of Health policy and the IATF, the face mask mandate is still ongoing and it should be respected because I think we should not be fragmented in our approach regarding protection of the people. And we know that face masks are essential to reduce viral transmission and protect the people, particularly that the COVID pandemic is not yet over. And it's an airborne disease with high transmission rate, even if the cases are milder. But because of increased mobility, there will be increase in transmission, particularly with the opening of the classes, both at the Department of Education and of course at the Commission on Higher Education. We so expect surge in the near few weeks. The other thing is that the admissions in the hospital, before we used to have only severe critical cases at around 70 to 80% secondary to the unvaccinated. We see right now almost 50-50 based on the DOH data and also from other hospitals. It means that those even vaccinated are also being affected and being hospitalized either to severe or critical cases. So meaning to say there's waning of immunity at this point in time because our last vaccination was December of last year. And of course with the mandate of President Bongbong Marcos to have the Pinas Lakas or the 100 days of trying to boost up the Filipino people, I think it's too premature to remove the face mask while we upgrade our immunity or a wall of immunity during that process. And perhaps after the 100 days, which will end perhaps on the end of October, then we can reevaluate whether we have actually increased the wall of immunity, reduction of the positivity rate. The positivity rate, Menchu, at this point is 12.6%, way high, above the WHO benchmark, which is less than 5%. So we're still premature at this point in time, and we appeal to our Cebu leaders to reconsider this particular executive order as articulated by the Department of Health and as well as the DILG cabinet secretaries.
All right, we'll take a look at those COVID numbers a little bit later on because you said yung positivity rate natin 12.6%. We'll take a look at that again a little bit later on. But right now, I wanted to ask you, Interior Secretary Benhur Abalos says he will suggest making Cebu City like a pilot implementer of this new policy. It sounds like you don't really support this. Am I correct in what I understood?
Yes, I think Secretary Benhur Abalos, well, based on his reaction and based on his statement, is that he's not yet convinced that it should be imposed because he knows the numbers and he wants to consult the IATF and review the guidelines. This is the second time that this particular face mask issue has been in the limelight again. And I think he would want to be careful knowing that the counterpart cabinet agency, ang Department of Health, which is our National Health Agency, dapat yun ang masunod. So ang hirap niya mag-decide, the DILG, the local government unit, kung merong mandato ang Department of Health, which I think is right kasi ang namamahala sa COVID pandemic ay Department of Health at yan ang kalusugan. Though I understand that there's local autonomy, but I think pagka sa ganitong pandemic, mananaig siyempre ang national policy over the local government code. It's something that I think is understood by a lot of people kasi safety ang pinag-uusapan natin dito. And ang public health emergency, hindi pa naman sinususpende ng WHO yan. And even the state of calamity, hindi in-extend pa nga ni Pangulong Bongbong Marcos up to December 22 because ang gusto niya, maitaas pa ang booster rate natin. Ang primary vaccines natin ay 72 million. 18 million lang ang booster natin. And we know for a fact that full vaccination would actually involve 2 primary vaccines and 1 booster shot. And then for those eligible, can actually take the second booster or the 4th shot. So doon tayo ngayon na naghahabol. And naglagay na nga sila ng timeline, yung Pinas Lakas, first 100 days, ang target nila ay 23 million. But right now, anemic yung response. So I think, hindi dapat tayo manguna kasi yung face mask nga ang panlaban muna natin ngayon while we wait right now for the achievement and fulfillment of the goal in the next 100 days of the booster program.
All right. Well, some would argue that a lot of other countries in different parts of the world have already dropped their mask mandates, be it indoor or outdoor, and they've been successful in controlling their COVID cases. Why do you think we are not able to do that here?
Well, because in the world data, which I presented to our group, the health advocates, in Southeast Asia, we're the last actually in terms of the booster because like Singapore, which announced by the Prime Minister na they're actually doing this same thing, optional in the outdoors and open spaces because ang taas ng vaccination rate nila, 90%, at ang booster nila 90%. And together with the other countries in the upper segment, that's Japan, Taiwan, Thailand, and the rest of the countries. Minimum lang nila 50% yung booster rate. Tayo 16%, 72% for the box, and only about 17 to 18% booster rate. So yun ang secret while they were able to do that kind of aggressive measures right now. Yun ho ang explanation for that po.
All right, we'll be talking more to Dr. Tony Leachon in just a little bit. Stay right here on The Source on CNN Philippines. You're watching The Source on CNN Philippines. I'm Menchu Makapagal. Our source today, health reform advocate Dr. Tony Leachon. Doc, let's look at the COVID situation. You were saying earlier na nasa 12.6, 12.4 yung ating positivity rate. But if you look at the current numbers, new cases have been below 2,000 the past few days, except yesterday, no, with 3,767. And our active cases are now at their lowest since July 21. Are you seeing, do these equate to good numbers on yung daily COVID count natin? Does this mean that we are, yes, go ahead, sir.
Well, I think those numbers are good. Nakikita naman natin bumababa yung numbers natin. There's no question about that. But ang hindi reflected dito, Menchu, is the rapid antigen test because
Okay.
ang nare-report lang naman sa Department of Health is the RT-PCR. And we know from the ground as physicians, there are a lot of COVID cases right now. Maaaring hindi admitted, but there are also increasing number of cases in the hospital. But even if it is mild, for the information of the audience, there's problem on long COVID, mga 20 to 30%. Yung ang symptoms ng COVID ay nandun pa rin, which cause shortness of breath, hingal, chest pain, mental health problem, which will affect. Then number two, kahit mild cases ka, you can still report to the office. You might not be admitted, pero hindi ka pa rin makaka-report sa office for 1 week until negative ka pa. So ibig sabihin, kung ang parameter natin is admissions in the hospital na more than 50%, to say that the healthcare system is overwhelmed, then we have to remind the audience and the televiewers na kapag nagkaroon ka rin ng COVID kahit mild, then it will also affect schools kasi dadami rin ng cases sa school, dadami rin sa colleges, and then sa labas. So hindi magre-reflect yan sa healthcare system. Kaya dapat piniprevent din natin ang pagdami nito. So ang ibig sabihin ng mataas na positivity rate, yan ay number of positive tests over the total number of tests. Ibig sabihin, marami pa rin nagpa-positive. So 100 tao, 12 ang madami po yun. Ayun lang ang nire-reflect natin sa RT-PCR.
Okay.
How about those na rapid tests? So it might actually be more than that. Ang tingin ko, 3 times more yung nire-reflect natin dyan sa figures natin, churned out by the Department of Health on a daily basis.
But our positivity rate is different from the reproductive rate. Yung reproductive number natin dito sa Metro Manila or sa NCR ay bumaba. Tama ho ba, sir?
Yes, tama yun. It's one of the parameter, less than 1 ang reproduction number natin. Pero there are other, ang isang atin pang metric is the positivity rate.
Okay.
So, yan ang mga tinitingnan natin at saka number of cases. So, the reproduction number, hindi lang yon. Kung makikita mo yung Octa Research Group, tinitingnan din niya ang positivity rate ng buong bansa. At yan din ang nilalagay din sa Johns Hopkins at sa WHO. In fact, iisa lang among the provinces in the Philippines ang less than 10%, 8%. At yan ay Bataan. So, the rest of the country above 10% pa rin.
Okay.
So, ibig sabihin, kailangan mag-ingat pa rin tayo. Tsaka nga, ang travel kasi, according to the Department of Health, nagko-cross borders ka. So, people going to other places will come back to the other places. So, let's say from high to low positivity rate or high to, so, magko-cross border. In an archipelago setting, it will be very difficult to control many viral surges in the long run. Hindi naman tayo isang isolated or landlocked area na pwede mo makontrol kaagad. But archipelago is much difficult to control. And of course, the healthcare system is fragile outside of the national capital region. The farther you are from the national capital region, the less number of doctors, the less availability of the test, and of course, the less sophisticated hospitals. Yun ang dapat nating isipin in terms of the human health resource system.
All right. Well, you mentioned more mobility children are now back in school. DepEd actually says there were no reports of COVID cases among students or teachers since the start of classes. But do you expect another wave to happen with the return to in-person classes?
Yes, may data niyan sa stage, yung PLO study, na nag-i-increase because of the mobility uh, sa college students. So may reports diyan. And we will monitor in the next 2 weeks. We don't want, of course, a gloom and doom attitude for the public. Tayo lang yung public safety ang kino-consider lang natin. Kaya we always believe the Department of Health, the WHO, no? Kasi if we believe na hindi delikadong COVID, wag ganon. Kasi ang mangyayari nga yan, we declare victory too soon. And if we believe na hindi natin kailangan ng umbrella, sabi nga ng WHO, dahil yung ulan ay hindi masyadong mabigat. Don't forget na mababasa ka din dito. So I think we need still umbrella kahit drizzles lang so that we will not get wet and be sick. So if we underestimate the virus is wily, nagpo-produce yan ng mga mutations. And that's the reason kung bakit tayo maraming mutation. Itong B5 is highly transmissible at sila'y dumadami because of the complacency and the lack of booster shots in many other countries. Kaya nga, ang susunod na boosters na lalabas ay bivalent that will address the old Wuhan strain and the new B5 variant which will come in a few months. Kaya nga, ang science ay nagde-develop din para to address the B5 viral transmission. But at the moment, yan ang ginagamit pa rin natin. We have enough vaccines, and according to the Department of Health, 23 million Filipinos will still benefit but still anemic. So we have to push education para ma-impluwensyahan natin ng ating mga kababayan. But if it is a counterintuitive approach, tatanggalin natin the only protection while the booster rate is actually low, then we will actually be doing a disservice to our country. Mas mahalaga yung public safety ng mga kababayan natin over the convenience or perhaps business aspect. Kailangan i-balance natin yan. And ang hinihingi na lang naman ng gobyerno hanggang November 2, face-to-face na so that we can have a Merry Christmas. Kaya nga sabi ni Pangulo, 100 days, sabi ni Vice President and Secretary of Education, November 2, face-to-face na lahat ng classes. So I think we need to heed the advice of the DOAs, the DILG, the President and the Vice President so that we can actually lower down the COVID cases, the positivity rate, and increase our booster rate going to a nice holiday season.
Well, we keep mentioning getting boosted and all of that. The health department is always reiterating its call for the public to get boosted as the booster vax rate in Metro Manila, as you mentioned, in other regions is still really short of 50%. What do you think are the bottlenecks?
Well, the bottlenecks are the following. Of course, the vaccine hesitancy, lot of misinformation, disinformation. The other one is availability, particularly with the expired vaccines of 5 billion of the private sector. And I don't know right now the current inventory ng expiring and active cases. And perhaps yan ang gusto rin malaman ng mga kababayan natin. And what particular vaccines ang natitira for vaccination. Kasi yung choice nila, nagmamatter yan in terms of their confidence sa pagpabakuna. And the other one is the access. Hindi lahat nakakapunta in the area. So we need to, make an innovative approach. Perhaps mobile vans or mobile buses, particularly ngayong umuulan, to bring the vaccines close to the residents rather than the residents going to the vaccination centers. I think that's one particular approach. Kasi according to the LGUs, some of their vaccination naka-cancel because of the rainy season. So we need to adjust. Lalo na ngayon, sinabi ng Secretary of Education, they will not use the schools for vaccination sites, which is correct. So therefore, we need to be innovative of bringing the vaccines close to the residents' houses so that they can be protected, particularly those elderly and vulnerable patients.
All right, we'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Menchu Makapagal. Our source today, health reform advocate Dr. Tony Leachon. So, Doc, you know, the DOH has revived its proposal to redefine fully vaccinated. Why do you think the government is not yet approving this?
Well, that's the $64 question. Hindi ko alam. Kasi that's a good question actually. If you look at the Department of Health website, ang nakalagay full vaccination 72 million. And yun siguro nakukonfuse ang tao. Why will you say full vaccinated ka with the 2 doses? Well, in reality, based on the CDC and other guidelines, ay 3. So that's perhaps the reason kung bakit adamant ang mga tao magpabakuna. Ang full vaccination, nakalagay na. We're fully vaccinated eh.
Yeah.
Diba? You look at the site of the Department of Health, nakalagay, fully vaccinated, 72. It has to be redefined to 2 primary vaccines and 1 booster shot. Yan ang fully vaccinated. Yan ang problema. Meron disjoint in the communication of the Department of Health. Redefine na ang kailangan 3 doses, and perhaps that would increase the yield as well as the booster rate. Yun ang problema natin. So, dun, nakita ko sa World in Data, ang baba ng booster natin. The rest of Southeast Asia, mataas ang booster rate nila. Yun ang particular reason kung bakit tinanggal na nila ang face mask mandate in their area. At ang pinaka last week lang, yung Singapore. Ang Singapore, more than 90% both vaccination and booster. Kasi I don't see any reason why the people will refuse a third dose or a first booster, nakatanggap na sila ng 2. So yun ang problema natin. So kailangan explain natin sa kababayan natin yan. Pangalawa, we need a booster kasi nag-wane yung immunity natin noong December, yung 2021, noon na tayo nagbakuna ng malawakan. According to the studies, 6 months mag-wane na immunity. So ngayon, July na. So, and then we have to consider also the shelf life of the vaccines. Alam naman natin ang Astra is 6 months. So, ang natitira Pfizer and Moderna as boosters. But look at the data. 9 months lang ang shelf life niyan. So, if we ordered the vaccines sometime December, magna 9 months na halos, 8 months. But the date of the delivery is that the date of the manufacture.
Okay.
So, kung nagbakuna tayo ng December, malamang above the 9 months pa yan. So, we need really to fast track in the first 100 days because mag-e-expire ang vaccines. Kung Pfizer yan, hanggang mga 9 months lang yan, September, October, unless i-extend ang shelf life ng manufacturer with the approval of the FDA. So dapat into context, maintindihan ng Department of Health at ng FDA, ng HTAC, as well as BBM, kaya tayo nagmamadali for the booster because it is anchored on the shelf life. Ngayon, kung hindi natin mababakuna yan up to the 100 days, natatapat dun sa ending na shelf life natin, then we will have a problem really pushing it. So we have August right now. I think the 100 days of the president will be on October 25. So July 25, August, September, October 25. That's correct. And timing din yan sa declaration of the DepEd na face-to-face class na tayo sa November. So kalkulado nila. And that's why they extended the state of calamity to December 2022.
Okay.
So that we can have more time to increase the wall of immunity of our people through booster program. Now, if you ditch off the face mask habang ginagawa natin ng booster, then we will lose the opportunity to defend our people and protect them. Kasi ang face mask, importante because of the portal of entry ng virus is upper respiratory tract. So we will lose that particular opportunity to protect our people. So mangyayari, magkakasearch na naman tayo, mag-online na naman ng mga bata, hindi na naman mga papasok.
So it's going to be
So
like
sa
a
akin,
never-ending cycle.
never-ending
Yes.
cycle.
All right.
That's correct. Yeah,
Well,
you hit it right on the head.
Well, thank you very much for your time, Health Reform Advocate Dr. Tony Leachon. We were supposed to have COMELEC Chairperson George Garcia here on the show, but unfortunately, he was unable to join us. So thank you for joining us here on The Source. Sitting in for Pinky Webb, I'm Menchu Makapagal. You're watching CNN Philippines.